We will be answering questions in real time. At the end of the webinar, an 8-question multiple choice poll will open. And we just ask that everyone take a minute to quickly complete it. Your feedback helps us improve and tailor our outreach. So today marks the first webinar of the series, and we're very happy to have Mariel Hufnagel lead today's discussion. Mariel is the executive director at the Ammon Foundation. She previously has worked as an advocacy organizer with the National Council on Alcoholism and Drug Dependence, and as the National Chapter Department Manager for Young People in Recovery. She has been recognized locally and nationally with numerous awards and featured by numerous media outlets. Mariel has also been a tremendous supporter and partner of the Partnership for a Drug-Free New Jersey, and has repeatedly shared her expertise at Knock Out Opioid Abuse town halls and other programs in this initiative. And I'd like to turn things over to Mariel now.
Thank you so much, Greg. I just want to double check and make sure that I can be heard.
You sound great.
Okay, fabulous. So hello all. Like Greg said, my name is Mariel Hufnagel, and I have worked closely with the partnership, specifically through the Knock Out Opioid Abuse initiative over the past couple of years, and it always has been a pleasure. So I'm grateful to have been sought out for this webinar. I'm grateful to continue to work with the partnership and the Horizon Foundation, and I'm excited to be kicking off this webinar series, really looking at how we can keep the conversation going during these unprecedented times. Because long before we had a coronavirus global health pandemic, this country was trying to fight another public health emergency, which is addiction. So I'm not 100% sure who all of the participants on the phone are. So I wanted to just start with a quick definition of addiction as we go into this conversation. This is not going to be most of what we're going to talk about, as well as my next couple of slides go over some statistics. I just think it's really important to make sure that as we engage in this conversation about the impact of COVID-19 on those who are using drugs and those who are in or seeking recovery, as well as what can be done, what is being done to try to ameliorate that impact. I just want to make sure we're all starting from the same point. People who suffer from addiction or substance use disorder are already marginalized and underserved by healthcare services, largely because of stigma. And much of that stigma is based on the erroneous but persistent belief, which is widespread even among healthcare workers, that addiction is a result of weak character and poor choices. Whereas science has clearly shown it to be a disorder arising from alterations in brain circuitry. So I thought it was important to just have us all start on this same playing field with the definition up on the screen and sort of setting the tone that addiction is a treatable chronic medical disease, which is important for us as we begin to look at the impact of coronavirus on this community, as well as what we can do to serve people. So let's just paint the picture a little bit further about what addiction looked like prior to coronavirus, right? So I'm not going to read every point on the slide. I like to have something up in the background and then sort of build on that. But so for those of you who are not aware, addiction in the last 30 years has taken unprecedented proportions. That's not to say that addiction hasn't been alive and well and ravaging our country for years before that. However, due to the creation of some of these synthetic opioids, and then also, in my opinion, some of our societal factors, which in the last 30 years have also moved more towards instant gratification and capitalism, there's kind of this perfect storm of overdose deaths. It's also important to say that that as specifically heroin and opioids have penetrated into a younger population, a more wealthy population, and a more white population, that addiction has gotten a different level of attention in the last 10 or so years, as well as over the past couple of decades, especially in the last 15 years, there's been a recovery movement where for years, people have been getting well from addiction. However, it's been primarily either by what one would call is natural change. So they had an alcohol and drug problem, they resolved it, and then they just sort of went about their normal life, or through anonymous 12-step fellowships, which have very much kept recovery sort of under the radar. So in the last couple of decades, again, specifically the last 10 years, people have started talking and proudly displaying their recovery status, which has also allowed for this shift in conversation around addiction. Also, several years ago, the Surgeon General did his first report called Facing Addiction in America. And there's been a lot of not necessarily new science, but a lot of greater recognition around addiction as a brain disorder. And so the statistics that I have up on the screen are just to sort of ring true why, amidst a global health pandemic, when absolutely is coronavirus one of the most important, if not the most important thing for us to be talking about and dealing with right now, we cannot forget or disassociate from the impact that addiction is having in our society, in our country, and in our state. This is just a slide so that we can see the opioid epidemic by the numbers, which is grossly upsetting. However, I also think it's important that we keep in mind that it's not just an opioid epidemic, it's an addiction epidemic, right? And that includes alcohol, methamphetamine, cocaine, as well as so many other things. So to just localize it a little bit, right, bringing us into New Jersey, which obviously, since we're virtual, I have no idea where all of the participants hail from. However, since this is the Horizon Foundation of New Jersey and the Partnership for a Drug-Free New Jersey, I just wanted to sort of just touch on the toll that addiction is having specifically in New Jersey, which is as high, if not higher, than what's going on across the country. And so for those of us who live in New Jersey, and for those of us especially who work in the field or are a part of the recovery community, we know these statistics all too well. And I think what has happened in the last 5 to 10 years is it's not only those of us who work in the field or identify as part of the recovery community any longer who know these statistics personally. We are finding that 1 out of 6 people have someone that they're intimately involved with. So either a husband, a wife, or a immediate family member who is impacted in one way or another by addiction. And the new statistics are also showing that 1 in 3 people know someone directly who's been impacted. So it may not be an immediate family member or their significant other, but a coworker or a friend or something more than, a 6th removed acquaintance. So before I move on, and again, this really hopefully is not meant to be the bulk of what we talk about. I did think it was important to set the stage. Greg, I'm just going to pause as I know you have questions coming in and making sure there's nothing that I need to address before we move forward.
Thanks, Meryl. I think that there may have been a question about the rise over the last decade, and if you could just expound upon that a little bit more as to exactly what contributed to that 700%.
Sure. So that's a complicated question, and we could certainly spend the whole webinar on it. I think that this rise has a myriad of what we almost would call the perfect storm or imperfect storm, because it's quite tragic. And this rise is also specific to New Jersey. So the creation of synthetic opioids has skyrocketed in the last decade, which means that the drugs that are being ingested are, and dare I say that drugs were never safe, but are even less safe than 5, 10, 20, 40 years ago. So drugs like fentanyl or carfentanil are being put into street heroin. There's also been an overprescribing when pain was added as the 5th symptom of health, right? So there's been an incredible overprescribing, and pharma has absolutely saturated the market with new opioid prescriptions. And those are probably the 2 greatest contributing factors to this rise that we've seen. The last thing I will say is that also, as addiction has infiltrated the upper middle class white community, I do also believe that reporting around overdose deaths has become more accurate, whereas before that, there may have been a significantly higher amount of overdose deaths, which were not documented accurately. They were attributed either to suicide or cardiac arrest or some sort of respiratory or chronic heart condition. And so I do think that that is also that we've become more accurate in our reporting over the last decade. Anything else, Greg, before I go on?
Thank you very much for that. That really puts a fine point on it. And please feel free to move to the next slide.
So what I also think is important is setting the tone on what recovery is, right? And we already talked a little bit about sort of this recovery movement. However, all too often we talk specifically about addiction, which is very visible in our communities, and the consequences and the suffering related to addiction is very visible. However, for a myriad of reasons, recovery isn't spoken about as much. And so I just wanted to set the tone for how we're going to define recovery as I continue on through this presentation, right? Recovery is a self-defined, self-directed process. And for many, it includes abstinence. For some, it does not. But we need to look at it holistically. And as this is SAMHSA's definition, which is, the Federal Agency for Substance Abuse and Mental Health Services Administration under HHS. And they have these sort of 10 principles I'm not going to go into each of them, but I love this principle wheel. And I think that as we talk about the impact of COVID on this community, as well as the ways to support and the solutions that are being explored, I think it's going to be really important to keep in mind sort of this wheel of principles, and that recovery, although abstinence is a vital part for many, is only one very, very small piece of the pie. I also think after seeing all of those honestly dismal and depressing statistics around addiction, I also do just want to touch on the fact that we have 23 million people who have resolved a substance use disorder or substance use problem and are living their lives in recovery. And so I do think that that's a really hopeful and promising number. And I think that that's important as we move forward and we're talking about the impact of COVID and some of the solutions for this community, that we recognize and realize what a large community it actually is. So I am not a doctor, I'm not a coronavirus expert, but I do think it is clear that coronavirus is, ravaging our world, our country, and our state. My understanding is that to date, and this was as of last night, that there was almost 400,000 positive cases of coronavirus in the United States, with almost 13,000 deaths. And then to parcel that down to New Jersey, there's over 47,000 known cases of coronavirus and 1,500 deaths. So this is very, very serious. And without going into politics or pro or con, what our current administration has done is has created this stay-at-home order, where really, if you are not on essential business, and essential business being truly limited to healthcare workers and a couple of other arenas, and going to the grocery store or the pharmacy, that the governor is urging us to stay at home, and that most non-essential, all non-essential businesses, gatherings, etc., have been canceled via executive order. So obviously there is a ripple effect of that, not just on the addiction community. The addiction community is a microcosm of our society at large. And I don't think necessarily that the issues that we're about to discuss are necessarily unique to the addiction community. I think all chronic treatable diseases, and I think all individuals in general, are suffering in some capacity and impacted in some capacity as a result of not only COVID-19, but the actions being taken by our government to protect us and to flatten the curve across the state and across the country. I also think that COVID-19 has brought to light some larger truths and some things that the addiction community and the larger community can really start looking at, specific to health disparity and income stability. So what I'm going to do, and this is going to be the bulk of the presentation, and I'm just going to pause before I move forward, is I'm going to talk specifically, because this is what my expertise in my area of passion and purpose is, about the impact of COVID-19 specifically on the addiction and recovery community. But again, I just want to pause, Greg, before I move forward and make sure there aren't any questions before I could continue.
Thanks, Meryl. We just wanted to point out to all the attendees that additional info and resources are available at knockoutopioidabuse.drugfreenj.org. Thanks, Mariel.
Great. Okay, so let's talk about each of these bullet points, right? And so the first one being heightened, obviously I'm working from home and my dogs just started barking. So a heightened, and now I'm not going to be able to say that word, susceptibility for an increased exposure to transmission of COVID-19. So those who suffer from SUD are among the most vulnerable population, specifically for getting coronavirus. This is because of direct challenges to respiratory health. They may also be especially susceptible to infection and associated complications. Specifically for opioid users who are already experiencing slowed breathing, which causes hypoxemia, which in turn leads to cardiac, pulmonary, and brain complications that would be significantly exacerbated by a COVID-19 diagnosis. Also, those who are actively using may or may not be social distancing, which could in fact spread COVID-19 amongst drug users and the public at large. It's also important, and we started talking about stigma early on, it's also important to note that stigma truly runs deep. And so when hospitals are pushed to their capacity, as they are now with coronavirus, there is an added danger of persons with a substance use disorder being deprioritized for care when they present with COVID symptoms. It is incumbent upon health workers to not discriminate against patients with SUD and to treat individuals with compassion and dignity as they would any others. So then let's look at limited harm reduction services. So harm reduction services, specifically, I'm going to talk about access to clean syringes. Whether or not you agree with harm reduction, whether or not you view it as enabling, there is significant data that talks about harm reduction saving lives, as well as improving communities by decreasing violence and other drug-related crimes, as well as showing that recovery outcomes from individuals who are using drugs and engaging with harm reduction services are significantly higher than drug users that are not engaging in harm reduction services, because it treats individuals with dignity and respect, allows them to build rapport with the providers of these harm reduction services, and ultimately has access to social services and opens the door to treatment. So the loss of harm reduction services is significantly grave for people who are using drugs. When we talk about uptick in accidental overdoses and overdose deaths, there's a couple of things for us to take into consideration. In addition to what we've already discussed regarding those who have COVID-19 having a greater impact to their respiratory system, which in itself increases the likelihood of overdose, a global health pandemic for the most healthy person is already causing anxiety, fear, panic, and social isolation. This can be a catalyst for increased drug use, and also later we'll talk about a potential trigger for someone to re-engage in drug use who's currently in recovery. Social distancing increases the likelihood of people using alone. Thus, opioid and other overdoses are happening with no observers who can administer naloxone to reverse them. And EMT and healthcare workers are generally in overload with COVID-19 emergencies. So response time for an overdose is longer and sometimes unavailable And so for those who are fortunate enough to have an EMT or to have not been social distancing while experiencing an overdose, people are also being encouraged to not use rescue breathing during the reversal process after the Narcan is administered. And this significantly decreases the likelihood of a successful reversal. And the last thing on this slide, and then I'll pause to see if there are any questions, are our frontline peer workers in danger. And so again, this is no different than the fact that right now, all frontline healthcare workers are in danger. However, because of this deep-rooted stigma that surrounds addiction, many of our street outreach folks and our peers that are going into hospitals are not being provided with the proper protective equipment. So they themselves are at high risk of exposure. Also for our peers who are primarily in recovery, there is an increased trauma from this experience. And so we have to be acutely aware of the risks they are taking and the potential impact on their mental health and their recovery. So before I go to the next slide, I know that was a lot of information, and I will pause and see if there are any questions.
Thanks, Meryl. So we have a number of questions. And what I'd like to do is, just before we continue, is to let everyone know that this slide deck, this PowerPoint presentation that you're giving, will be available for download. We will provide all the attendees with information as to how to get access to these slides. One question that we had was that, are there online Narcan trainings available? Are you aware of any? And also, another question, I guess, what type of overdose and prevention response plan can I implement in my home?
Sure. So, so yes, there are some online Narcan trainings. Towards the end of this presentation, I will be providing everybody with what I think is the most comprehensive list to New Jersey phone-based and virtual support services through the New Jersey Coalition for Addiction Recovery Supports, which I'm proud to sit on the board of. And not only are there online trainings available, there also is access to naloxone and Narcan via delivery and via mail. And those resources are also at that link, and as well as on the PowerPoint, with which all of you will get, is my email address, and I would be happy to help anyone navigate that or anything else during these very scary times. Specific to the second question about implementing an opioid reversal plan, that's difficult to answer only because everyone's circumstances are so different. I think it would depend on who the person is that actively is using drugs. What type of drugs they're using? Are you the drug user, or is it somebody else in your household? Do you have access to naloxone? Are you trained in how to administer it? What's your proximity to a hospital? There are so many variables that I would be unable to provide sort of a cookie cutter answer, but I certainly would be happy to talk with anybody offline, and after gleaning sort of all of those variables, work with you to the best of my ability to try to develop one.
That's great, Meryl. I have a few more questions, but we can get to those after you move through the next slide.
Okay. So still talking about impact, right? And the reason why talking about the impact I think is so important is because how do we know what type of support is needed until we really know what the impact of of this global health pandemic, of coronavirus COVID-19 is on the addiction and the recovery community. So access to treatment is significantly impacted by this global health pandemic. Specifically when we talk about medication, and so when I talk about medication, I'm talking specifically about methadone, buprenorphine, which is also known as Suboxone, or Vivitrol, which is the subcutaneous shot. So persons specifically with an opioid use disorder not only may, but are facing real challenges in obtaining their medication. Although SAMHSA has advised opioid treatment programs to provide take-home medication more flexibly during this pandemic, clinics and doctors have autonomy, and not all are abiding by these new regulations. For those of you who don't know a lot about methadone or buprenorphine, oftentimes the treatment protocols here can be highly punitive, and you need to earn your medication based on sort of good behavior and abstinence. And so methadone specifically is dosed on a daily or every other day system, meaning that individuals now are still having to go to methadone clinics in spite of coronavirus, in spite of stay-at-home orders, to get their medication, which is absolutely essential. And so those who are continuing to need daily or every other day dosing, it's an incredible likelihood of the spread of COVID-19 within that population and within the essential workers that are working in these clinics. So for buprenorphine, there is a lack of doctors, and that has been true way before coronavirus. However, the lack of doctors, especially the lack of doctors that are available to a Medicaid population, which is many of the actively using individuals, acts as a tremendous barrier. So when we talk about inpatient care, which would be detox or inpatient treatment, many treatment providers have closed their doors and are not accepting new clients. That may be because they actively have a COVID-19 case and need to quarantine, or they simply have just decided to safeguard their population. And for those who remain open, the wait time is increased. So some places have a 3 to 4 week wait time for a bed. For those of us who are familiar with the treatment industry and access to care, we know that this is not a new issue. However, it has been substantially exacerbated by COVID-19. And for those of you who are familiar with our population, waiting for a treatment bed, even during the best of times, for 3 to 4 weeks, could be a death sentence for somebody who's actively suffering from a substance use disorder. So then couple that with being amidst a global health pandemic and the social isolation, the lack of community and support, the anxiety and the fear, that could be an incredibly long wait. So when we talk about outpatient care, my understanding, at least across New Jersey, is that all outpatient care has been disbanded. There are some telehealth options, but again, now we think about some of the health disparities, right? Not all individuals are able to engage in virtual support services. Not everybody has Zoom capabilities or a laptop. And so outpatient care has been moved to a virtual support, which is simply not accessible to many, not to most. Questions about that before I move on to social distancing, eliminating face-to-face supports?
Thank you, Meryl. I think that based on your previous slide and this slide, there are a lot of questions coming in that are focusing on what to do in the home. In other words, Narcan training online, social distancing and its effect on those in recovery. And specifically, we have a question that asks, how does a person give more help other than Narcan after the reversal? So it's a specific question about the medical reversal and then what to do afterwards. So if you don't mind just stepping back from the slide you just covered and just maybe address what do people do after the reversal as far as providing support.
Sure. So I do want to be careful to stay in my wheelhouse and not give specific medical advice. I'm not a doctor or a nurse. However, I think it is important to keep in mind that after a naloxone reversal, there is a handful of things that are often seen. And one is that people often are susceptible to another overdose. So keeping close watch after the reversal is really important, and hopefully having more than one naloxone dose at your home. I know that's not possible for everybody, and that's why it would be ideal for everyone after a reversal to go to the hospital, and then again, maybe not so ideal during this time. But the opioid antagonist that's in naloxone, it doesn't just vanish all of the opioids from the individual system. It works as a blocker. And so after that naloxone is all used up, depending on the amount which was being ingested by the individual who overdosed, it is possible for a second overdose. And so being aware of that and carefully watching and monitoring the individual post-reversal is really important, as well as being aware of the fact that many people, when they come out of a overdose reversal, can be incredibly angry, anxious, belligerent, and that can, become a catalyst for outbursts or violence. And so making sure that while monitoring and protecting the person who has just had an overdose reversal, that you are also taking precautions to protect yourself, and whether that's emotionally preparing yourself as well as, physical proximity, to the individual should the worst arise.
Thanks, Meryl. I have one more question that I think we should address at this time.
Great.
And someone asked, with the order to social distance, and we're all quarantined in our homes, do you think it's safe to say that there might be an increase of death because of this process of withdrawal? And, most addicts cannot just stop, but they need to wean themselves off their drug. So what is the best way to go about this if you know someone who is an addict?
Sure. So the first thing I'm just going to say is I'm going to say that I hate the word addict. I think it is stigma provoking, and I would urge you to use the word drug user or person who suffers from a substance use disorder or someone who's actively using drugs. The word addict perpetuates this negative connotation and defines it defines the person by what they suffer from. You wouldn't call somebody with cancer a cancerite, because cancer doesn't define them. So addiction also does not define somebody who's actively suffering. So that aside, though, I think that that's a really important question. And yes, I do think we will be seeing an uptick in overdose and overdose deaths, and some of the data coming out of DMI already shows that. However, I do think it is important to keep in mind that opioid withdrawal is not fatal, minus weird, severe complications. Alcohol withdrawal, however, has the potential to be fatal, which is why liquor stores have remained open. So cocaine, even though there can be fatal complications like a heart attack, something with the respiratory system, especially, right now with coronavirus, most drug withdrawals are not fatal, wildly unpleasant. And I would suggest, if you have somebody who's going to be withdrawing in your home, or you yourself are going to be withdrawing, that there are things that you can try to do to make yourself as comfortable as possible. But withdrawal itself, except from alcohol and benzodiazepines, minus complications, are not fatal.
Thank you, Mariel. And in the interest of time, I was going to say that maybe we should move on to your next 2 slides or so, and then circle back to any questions at the end of the presentation.
Absolutely. And I'm happy to stay on past 12 o'clock for anybody who has questions. So the next 2 bullets on this slide are important because this talks much more about the impact on people in recovery, right? Whereas the bullets previous to this, minus peer workers, have really kind of talked about the impact on those actively using drugs and those seeking recovery. So social distancing via Governor Murphy or any other governor's stay-at-home order has eliminated face-to-face support. So obviously that is obvious, right? Because all face-to-face contact, except with people who live in your home, has been eliminated, whether you're in recovery or not. However, and that in itself, I think for most people is destabilizing. My mother, not in recovery, nor does she need to be. She's elderly. She lives at home with her 2 dogs, and has felt incredibly destabilized by not being able to have her routine and go to the supermarket and see her friends. And so this destabilization, I think, is being experienced globally, right? However, for those of us who are in recovery, face-to-face support, community, fellowship, is a huge aspect of many individuals' recovery process. And so things like mutual aid meetings, whether that's 12-step or non-12-step, like Smart Recovery, faith-based support, recovery houses, collegiate recovery programs, and one-on-one therapy, just to name a couple, have all been eliminated, at least face-to-face. Recovery houses, for example, are all quarantined, so they're not accepting new individuals. College campuses are closed, so collegiate recovery programs are not active. Therapy is not deemed essential, so even though it may have moved to telehealth, there still is something significantly less personal, especially for someone who's been receiving therapy not via telehealth. And faith-based support is not just connected to specifically faith-based recovery supports, but many people recover in their communities, and faith-based support can simply look like their church group, their temple group, their mosque group, and And so it's not necessarily direct recovery support, but having a faith-based community may be supporting their recovery. And for mutual aid meetings have been disbanded face-to-face, and many people in recovery rely on mutual aid meetings as a vital part of their process. And when we talk a little bit about support, I will talk about the vast array of virtual and phone-based support for all of these options. But again, not accessible by everybody, and for many, not as effective. I also think it's important to talk about some of the indirect effects of COVID-19 on our community, which is really important as we look at addiction holistically. And I said this at the beginning, abstinence or moderation are important parts of most people's recovery, but it's just one piece of the puzzle, and we have to look at the whole pie, right? And so things like housing insecurity, people who are homeless or in shelters, coronavirus is especially, this health pandemic is especially impacting food insecurity, someone who was an food pantries are open, but with limited hours. Many people who are on WIC or food stamps, the items that they're eligible for are sold out at the supermarket. Access to healthcare is limited for all during coronavirus, but especially for those with a substance use disorder. And then coronavirus has specifically impacted very heavily our incarcerated population. And we know that our incarcerated population have very high instances of substance use disorder. So I think it's really important when we think about the impact of coronavirus, that it's not just about treatment and recovery support services. It's also about all of these other parts of the wheel that go to put together somebody's life. So any questions before I go on to some of the specific services which are available?
Thanks, Mariel. Why don't we move on to the specific services, and then at the end of your presentation, we'll hear from Jennifer Gowdy, and we'll address any additional any additional questions. Wonderful. After Jen has a few words to say.
Okay, wonderful. So these are the services that have been created or were pre-existing, specifically coming from the state. So I'm not going to go over each of these, but I did want to highlight these as these are coming from the state. So specifically using 211, there is a handful of different phone lines for telephonic support coming out of Rutgers, coming out of ReachNJ, and also coming out of the, and also peer support via the phone. And then there's also a mental health helpline that's specific, not to substance use disorder, but specific to the COVID-19 crisis and the mental health issues that are arising from this. So I just thought these were important to provide. What is equally as important and is much more specific to the broader recovery community is this compilation of resources that has been put together by the New Jersey Coalition for Addiction Recovery Support. So NJCAR's mission is really about uniting the recovery community throughout the state and looking at the entire continuum of care for recovery support services. So everything from recovery high schools to collegiate recovery to family support to harm reduction to peer support to recovery housing to advocacy and stigma reduction. And I've probably missed a couple of things. But what I must say is that the recovery community is full of intelligent, caring, compassionate, and most importantly, resilient people. And so when COVID-19 first started, the call to action in the recovery community, and when I say the words recovery community, I don't just mean people in recovery, I mean allies, people working in the field. I mean, really the recovery community is made up of everybody. But so the call to action was, how do we support people in recovery and family members during this time of social distancing? And so this link and this list is the best compilation that I've seen of all of the virtual and phone-based support services. And the call to action, I must say proudly, really was met. 12-step fellowships are, many home groups are now meeting via Zoom. Smart Recovery has a whole list of online meetings. Refuge Recovery, meditation, church and synagogue communities are meeting virtually. There are peer support telephonically and virtually. There is family support telephonically and virtually. The list goes on, and I would urge you to access this list and share about the virtual and phone-based support services that are available. And the last thing I'll say, because we're coming close to the hour, is that the way that you as a human being can support a loved one or anyone in recovery that you know is no different than any other time, right? We want to look at, talk to, and treat people who are in recovery with non-judgment, with patience, with encouragement, and encourage healthy habits, encourage responsibility, encourage structure, ask how you can help, and listen, actively listen. And the only thing that I would say is slightly different is hopefully we can all have a little bit more compassion, a little bit more empathy towards our fellow humans, and maybe go above and beyond with checking in and being supportive to the individuals that we know who are either in or seeking recovery or actively using drugs. So that pretty much wraps up my presentation. And I am going to leave this up because this is for the next webinar. This is the information I was given, and I'm going to toss it back to you, Greg and Jen, and then I will stay, for as long as necessary to answer any questions after you guys close up.
Thank you, Mariel, for sharing your expertise today. That was a great presentation. What I'd like to do is just introduce Jennifer Gowdy to deliver some closing remarks at this point on behalf of Horizon Blue Cross Blue Shield of New Jersey. Jennifer is the Senior Program Officer of the Horizon Foundation for New Jersey. Jennifer?
Thank you, Greg. Hopefully you can hear me now.
Sounds great.
Perfect. Good morning, everyone, and I apologize for the technical issue I had earlier. It was really my honor to join all of you this morning, and I would like to thank you for your interest and attendance today. I know that it is a very challenging time for everyone, and we greatly appreciate your dedication to continuing the discussion on how we can knock out opioid abuse in New Jersey, especially during this critical time. As many of you are aware, due to the COVID-19, the Partnership for Drug-Free New Jersey has postponed the scheduled in-person spring town hall events until the fall. So the Horizon Foundation has been really working closely with the partnership to develop ways to continue this conversation and community engagement through social media and through the partnership's website. And as Greg mentioned earlier, the partnership team has really quickly adapted to this by planning a series of webinars centered on how the pandemic will impact the opioid crisis. And today's webinar is the first in that series. Horizon, through its philanthropic arm, the Horizon Foundation for New Jersey, is extremely proud of our collaboration with the Partnership for a Drug-Free New Jersey to bring you today's webinar and as well the Knock Out Opioid Abuse Initiative. This initiative is part of our company-wide response to address and help end this public health crisis in our state. It represents a large portion of the Foundation's $1.3 million we have invested to provide support for opioid prevention and education programs to help families and our members. So in closing, I want to thank the Partnership for Drug-Free New Jersey team for putting this webinar together so quickly, and to Mariel for your excellent presentation today. Together, we can make a positive difference in combating this epidemic. Thank you so much.
Thank you, Jen. And thank you again, Mariel. I'd like to ask everybody to take a moment and answer our 8-question poll that you'll see has launched. It'll only, like I said, take about a minute. The Partnership for Drug-Free New Jersey and the Horizon Foundation for New Jersey will be providing resources on our website, knockoutopioidabuse.drugfreenj.org. You can visit the site to learn more about upcoming webinars and other programs to fight the opioid epidemic. Specifically, registration is open now for the April 30th webinar with Dr. Andrew Kolodny, who will be addressing how the opioid crisis will be impacted by the coronavirus pandemic. We will also be following up with everyone who registered for this webinar, and we will email you a list of resources, a brief survey that you can complete online. And we want to thank you all again to committing to being a part of the solution to New Jersey's opioid crisis. On behalf of Horizon Blue Cross Blue Shield of New Jersey and the Partnership for a Drug-Free New Jersey, we wish you continued good health.